Well, while they continue to sort that out in Washington, plans move ahead. And it can be especially confusing in terms of if you're a senior and maybe you're involved with Medicare and so forth. Well, Bill Hayner is here this morning. He's the founder and CEO of SeniorQuote Insurance Services. You really target supplemental insurance for seniors, correct?
Supplemental and Medicare Advantage.
And Medicare Advantage. So first off, let's talk about what's happening right now and what's going on in Washington, D.C., and whether or not the implementation of Obamacare is going to affect the seniors that you primarily deal with right now.
Right. So Obamacare basically deals with the 65 and under group, and it doesn't affect the seniors that much and Medicare at this point. So it's targeted to bring on about 20 million people that aren't covered right now into the system, so they are covered.
Okay, so it does not affect senior citizens primarily. So good. So you can set that aside for just a few moments and not worry about that. Now, why supplemental insurance, and why did you decide to get involved with this? I understand there's a personal reason why you decided that this supplemental insurance was necessary.
So I founded a company called SeniorQuote Insurance Services back in 1983, and the reason was that the baby boomer generation was turning 40 and having kids and mortgages and needed insurance, but it was all sold individually by agents. We decided to do a comparison service where we could get the cheapest price for the same amount of money. So we founded that. It was a phone service. I turned 65. Everything was complicated. Part A, Part B, whatever, got it. When I turned 70, I had 5 operations in 2 years. So I had open heart, arthroscopic surgery on the knee, cataract, ruptured appendix. $600,000 later, my wife got a bill for the heart operation of $440,000, said patient responsibility, all paid for by Medicare and my Medicare supplement. Had I not had the Medicare supplement, which covers the gap for what Medicare doesn't have, I could have had a substantial cost to my family.
Now, do you know how much that gap could have been?
Generally, it's about 20. Medicare covers about 80%, and 20% is not covered. So I could have been talking $100 and some thousand.
$100 and some thousand out of pocket.
Out of pocket.
And they would have expected you to pay that. All right, so this supplemental insurance, this gap insurance, that's got to vary from company to company as well. So your whole concept with SelectQuote, you take that right on over here now to SeniorQuote, and help people shop then?
Exact same model. So basically, we're licensed in multiple states. We have professional licensed certified agents selling the Medicare supplement products, and we represent multiple carriers. You've heard of them: Blue Shield, Blue Cross, Humana, United Healthcare. Well, take me for instance. I have a supplement policy. I pay $200 a month for that. The variation in my zip code, and it varies by zip code, is $150 a month to $250 a month. We recently had an investor in that was the former chairman of Scripps, and he said, well, give me a quote. And he was paying $120 a month, and he could get the exact same plan for $75 a month.
The exact same coverage?
Exact same plan.
So if you don't shop, you don't do your shopping, don't do your comparisons, don't do your homework, again, that's just money down the drain.
Absolutely.
Okay, so it's SeniorQuote, and we've got the picture of the website up here. What's the best way for folks to do this? Now, there's going to be some folks over 65 that are not going to be necessarily internet savvy.
Right. Well, the best way is www.seniorquote.com, but we operate with professional agents over the phone. So it would be to call our 800 number, which you can get on the website, and talk to us, and we can do a needs analysis, walk through different prescriptions, whatever they have, and find the right policy.
Yeah, I hope I didn't misspeak there, because my parents are great on the internet. My grandfather was into his 90s. He was better on the internet than any of us. But for those of you that aren't internet savvy, or you just don't care to operate that way, they pick up the phone, they'll answer, and there's your phone number right there for SeniorQuotes. And please, folks, do this sooner rather than later, Because again, the insurance situation is only going to get more complicated. It's not going to get less complicated as time goes on.
And the #1 cause of bankruptcies in seniors is health-related problems.
And this can cover the gap and make sure that doesn't happen to you. So, Bill Hainer, thank you so much. Recognizing a need, filling it, and making it simple.
Appreciate you bringing me on the program. Thank you, Mark.
You're more than welcome. Thanks for coming in. It's SeniorQuote. All right, if you need more information, again, as always, san diego6.com, click on San Diego Living.